Okay, chapter 8. Let's talk about the eyes and the ears. Sensory system is a network for detecting stimuli from the internal and external environments, needs to maintain homeostasis. Signals are generated or by sensory receptors, can be transmitted via the central nervous system for interpretation. All right, let's jump in this. The senses. Do we learn these in elementary school? Like it was a long time ago. Anyway, touch, taste, smell, vision, um, whatever the other one is. This one talks about pain receptors are found in the skin. You also have pain receptors in joints, bones, internal organs. Tactile is the sense of touch. Pressure, deep touch located beneath the skin into the deeper tissues. Proprioception is awareness of body position in the receptors of muscles, tendons. I said bones, joints is what I meant, to help to judge the body's position and coordinate muscle activity. Gustation is the taste, has to do with the tongue, taste buds on the tongue. They detect the sweet, sour, bitter, salty, whatever flavors that our tongue offers us. Olfaction is smell. Those receptors are in the nose, obviously. A little diagram here. I like this one because it shows you where the actual synapses are located and like where the sensory is located within the skin, which we just talked about skin. So you can feel cold here, pain, touch, pressure. It takes, like when you're getting a massage, they have to push down deep for you to feel pressure. All right, hearing, equilibrium, vision, it's all still part of the senses. Equilibrium is actually controlled by the ears. Inside the ear, yeah, so is hearing. We know about vision that we have vision out of our eyeballs. Terminology, equilibrium, gustation, hearing, olfaction, proprioception, sensory receptor, tactile, and vision. Suffixes, algia, osmia, yes. Okay, and then the exercise. Okay, the ear, the anatomy of the ear. This book, the visual diagrams and photos here, figures are excellent. You have the outer ear, the middle ear, and the inner ear. The outer ear is made up of these things. It's everything from this side of the tympanic membrane or the eardrum. The middle ear, this is where the malleus, the incus, and the stapes are located. This is where a lot of us get those middle ear infections for multiple reasons. Here's the cochlea inside the inner ear. This is where our hearing is managed. The vestibule canals, there's the cochlear nerve that feeds into those, what was it, 13 trigeminal or 13 nerves, cranial nerves, thank you, cranial nerves that we talked about when we went over the nervous system. So anyway, for this course, outer ear, middle ear, inner ear. I don't expect you to memorize the exact anatomy of all these tubes and vesicles and things like that. So again, the cochlea, sorry, is responsible for hearing. And then this page just speaks about the actual anatomy. Here's some terminology. Auditory tube, cere- Lord, I would say cerumen. But when I read it, the phonetics of it, mnemonics of it, it messed me up. So cerumen, or cerumen, pronounce it how you want. um, Everybody may say it a little differently. Incus, labyrinth, malleus, ossicles, pinna. Da, 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 da. Keep reading. More root words. Audio. Odo is ear, like otoscope. Audio or audio, even audio visual, like AV equipment. Audio is for hearing. Myringo is a tympanic membrane. So a myringotome is a knife used for surgery on the eardrum, where they put in ear tubes from time to time. Tympano, salping. This is auditory. Okay, labyrinth. I'm just reading these out loud. You guys can do that. Clinical aspects of hearing. You can have hearing loss for many reasons. If it's sudden new hearing loss, it definitely needs to be evaluated because we want to make sure there's not a tumor in there. Otitis, that's inflammation of that ear from, again, multiple reasons. You can have swimmer's ear, which is very different than a true ear infection. Otosclerosis is where the bony structure of the inner ear deteriorates and it turns into like sponge-like material instead of the bone. Meniere's disease is where people suffer from severe vertigo and dizziness. Acoustic neuroma, so this is a tumor. This is what I was just referring to. If somebody has a sudden loss of hearing, we need to have that evaluated. Audiologists are great assets in the healthcare system. They perform the hearing test for anybody who's having trouble. Usually that's done in an ENT's office or an ear, nose, and throat doctor's office. So here's those disorders listed and the terminology and the key terms, the definition, if you will. Here's more terminology. I'll let you read that. Abbreviations. ENT is a very common one for the eyes, the ears. HL I'm not familiar with. OL I'm not. OM I am familiar with. Otitis media. TM, tympanic membranes. You would really have to specialize in allergies or ear, nose, and throat to require actually have to need to know every one of those abbreviations and wonder which one's approved at different doctors' offices and which ones are not allowed within a surgical setting. Anyway, okay, so moving on, the eye. The eye is protected by our orbital sockets. A lot of athletes or someone who's recently gotten in an altercation or even a car accident, you can break those orbital bones, you can fracture them. It takes time for those to heal. There's no reconstruction to that. It just takes time. So we want to protect our eyes, as best as we can. Lacrimal, a lacrimal gland, or even lacrimal canal, lacrimal sac. Lacrimal has everything to do with tears. You'll associate the word lacrimal with tears. The productive conjunctiva, excuse me, is a thin membrane that lines the eyelids and covers. The eye is another protection. There's a lot of protection here in the eyeball itself. It's pretty amazing what that organ, all the layers of protection. The retina, the rods. Rods function in dim light, providing low visual acuity. By the way, visual acuity is sharpness, how sharp you can see. But the rods can help. Um, they function in dim light, where cones are active in bright light to have visual acuity. Just to read about that, let me know if you have any questions. This shows the function of the iris. I thought, hang on, yeah, I think I'm right. Yeah, I am. I just saw it. Okay, so this shows the tiny little muscles that contract in the iris to constrict the pupil, or if the muscles relax or pulled in a different way to dilate the pupil. So that's why we have an iris. Refraction, macula, when you go to your eye, and everybody should get an eye exam, by the way. You don't have yearly. You don't have to get an ear exam yearly, but you should definitely get an eye exam yearly, no matter if you wear glasses or not, if you need a prescription or not, just to have some of the diagnostic testing to make sure all the blood vessels and everything looks good inside the actual eyeball that you cannot see from the outside. We've got some more Greek words to focus on here. More terminology, accommodation, aqueous humor, ciliary body, lacrimal gland, lens, macula, etc. Condition. Well, where's my conditions of the eye? Okay, hang on. Bleph is a root word pertaining to the eye. Dacryl, lacrimo, or lacrum. Opt, ocular. Ocular is all about the eye. So pertaining to the left eyelid or pertaining to the left eye is sinistroocular. Okay, where's the right one? I don't know. Protrusion of the eyeball would be exophthalmos. Okay, we're going to keep going. Another exercise. Opsia, opia. So heteropsia is the unequal vision of two eyes. Optia is blindness in half the visual field. That would be so frustrating. Okay, here's our clinical aspects of vision. Errors of refraction. Astigmatism is pretty common, where the eye is kind of shaped like a football instead of a round here. Infection, our eyes, again, have lots of layers of protection, but they can still get infected from many different things, whether it's debris in the eye, a laceration to the retina accidentally, just putting dirty fingers in your eyes. Don't do that. In 2025, we should only be um, touching our eyeball. Well, we shouldn't be touching our eyeball, but if we have to, wash your hands before you touch your eyeball. Disorders of the retina, you can review that. Eye surgery. Oh, eye surgeries have come such a long way with the technology and the lasers. So these are great visuals here too. This is an example of macular degeneration, how you lose your vision from the inside, or you can't see the center of the photo. So here we go. So here's normal, there's macular, and then diabetic retinopathy is completely different eye disorder and cataract surgery. I said cataract surgery. Cataract itself is something that accumulates over time, but the surgery for it is easy. Do I want to say the word easy? Maybe it's simple, not easy. But it's very common to have that surgery, and people get a lot of excellent outcomes with very quick vision relief or vision repair. They can see again once that cataract is removed. It's a growth, or it's a yeah, it develops over time. Glaucoma is pressure in the eyeball, very different than cataract. Ba, 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 ba. Stigmatism, glaucoma, hyperopia, myopia. You can read all about those. Here's more terminology. That's interesting. Fundus is actually, I did not know it was part of the eye. There's actually a fundus inside of a female uterus, too. So that's interesting that our medical terminology can be used for different body organs. Okay. Oh, here's more abbreviations. Another little cute case study there. And that's it. Chapter 8. Let me know if you have any questions.